Harlow News. Today's top story is active shooter preparedness. Did you know that only approximately 30% of schools and teachers feel prepared for an active shooter incident? Would you know what to do if an active shooter walked into the room right now? According to the FBI report, in 2024, there were 24 active shooter incidents, down from 50% from 48 active shooter incidents in 2023. The importance of active shooter preparedness, as well as the deficiencies of it, are highlighted in incidents such as Virginia Tech in 2007, which had 32 deaths, including 27 students and 5 faculty members, Sandy Hook in 2012 with 27 deaths, including 20 children and 6 staff members and 1 adult and 2 injuries, as well as Parkland in 2018 with 17 deaths, including 14 students and 3 staff members. Active shooter preparedness has the potential to save lives, increase safety, and decrease injuries across all settings. It can help to decrease panic and confusion by teaching individuals how to make calm and fast-paced decisions, improve emergency responses by knowing what to expect, help vulnerable populations by learning how to secure and assist students, and have a safety culture in place. Active shooter preparedness has the potential to save lives, increase safety, and decrease injuries across all settings. It can do this by decreasing panic and confusion by teaching the individuals to make the fast-paced decisions, and consists of training, which can help to make quick and informed decisions under stress, preparedness by reducing confusion and panic, decreasing harm and injury by teaching awareness of sheltering in place, barricading and evacuation, as well as first aid training such as stop the bleed, emergency response improvement such as simulation as well as drills, psychological preparedness like decreasing fear by improving confidence and clarity, and mitigating trauma by giving you a sense of control, as well as legal and ethical responsibilities such as duty of care to protect patients, students, as well as staff, and culture safety. So awareness, community involvement, and you want to have a collaboration with public safety officials as well as civilians in case there is an issue that arises. And so some potential health risks from the condition that can result from the exposure would include psychological trauma, such as PTSD, where you can have flashbacks and nightmares and emotional numbness, as well as panic and anxiety disorders that can result in long-term fear, especially in crowded places, and depression, which could be feeling of survivor's guilt or hopelessness, as well as physical injuries such as fractures or lacerations from trying to escape from a situation, injuries from tripping, falling, or stampedes during panic, or hearing damage from gunfire in enclosed spaces. So what is the real cost of preparing for something? That could be, financial. So schools and workplaces spend billions of dollars on safety equipment, which can include metal detectors, security guards, bulletproof backpacks, surveillance systems, emergency alert technology. In 2022 alone, the security industry was worth over $3 billion and is growing. Psychologically, lockdown drills are traumatic and can cause anxiety, PTSD, and nightmares. In 2020, a study found that drills can increase stress and depression. So, some epidemiological data that was collected includes incidents and trends of active shooter events, such as FBI reports. So, annual reports that provide data on the number of events, including fatalities and injuries, as well as the Gun Violence Archive, which does track mass shootings and includes profiles and casualty counts. School and workplace preparedness assessments can include the Bureau of Labor Statistics, which collects data on workplace violence. And hospital and emergency response data can include the emergency department and trauma center data on injuries from active shooter incidents, as well as EMS responses. And preparedness and training participation can be data from agencies such as the DHS, FEMA, and local departments on how many people or institutions complete preparedness training. So what data should be collected? So identified gaps include standardized national tracking or preparedness levels, psychosocial impact metrics such as long-term PTSD and anxiety from post-exposure, and effectiveness of preparedness programs, as well as demographic disparities. So what has been and should be done can include federal initiatives such as DHS, FEMA, and DOJ have created toolkits and training modules for schools and businesses. And state levels safety audits can include some things that some states require annual drills and audits and research funding. So limited CDC and NIH funding is directed towards violence prevention, including gun violence. So what should be done? We need to create a national preparedness index for readiness for active shooters, as well as standardized data collection on drills, trainings, and mental health follow-up, as well as fund longitudinal studies on communities that are impacted by mass shootings to evaluate long-term effects and recovery. So some legal duties can include negligence lawsuits. So school, businesses, and healthcare institutions can be held liable if they fail to take responsible steps to prepare or respond to active shooter events, as well as premises liability. So property owners can be sued if a shooting does occur on their premises and they did not take adequate security precautions. There are some workplace safety laws, such as OSHA compliance and training requirements. And there is some privacy and information sharing, such as HIPAA, which limits health data that can be shared, and FERPA, which is Family Education Rights and Privacy Act, which restricts schools from sharing student information unless there is a threat, as well as gun laws and policies, such as the Second Amendment challenges, red flag laws, and state-specific regulations. And there are some mandated drills and trauma impacts, such as parental consent and trauma claims and state mandates. So there are some criminal laws and liability, such as failure to report threats can, in some jurisdictions, lead to criminal liability and false alarms. So making a false report about an active shooter can lead to criminal charges, especially if it disrupts school or business operations. There is some stigma and bias, so there is mental health bias that is there, such as active shooter protocols often emphasize warning signs, which can stigmatize individuals in mental health. And racial and cultural profiling also exists, such as students or employees from marginalized backgrounds can be treated unfairly and targeted by implicit bias. And there is psychological harm, such as trauma from drills, lack of consent, and there is equity and access issues as well. So an equal protection, like wealthier schools and organizations can afford more security measures. And resource allocation ethics are also an issue. So spending large amounts of security can divert funds from other things such as counseling and education. So there are some also ethics about arming staff, so risk of misuse. So even a well-trained individual can make a mistake that is fatal under a stressful situation, especially in a chaotic environment. And transparency and communication, such as lack of involvement of students, staff, and parents, can feel excluded from discussions about safety protocols, and there is a duty to inform. So ethical practice requires that there's a clear communication about risks and training, but this can fall short. And for preparedness and prevention, there is a reactive mindset. So there is possibly an overemphasis on shooter response, like a lockdown drill. And that can overshadow some investments in early intervention and mental health services, as well as ethical interventions to prevent this, such as preparedness should not come at the expense of addressing systemic cause of violence, like bullying or trauma or access to guns as well. Now we're going to join Michaela. She's on site at Carlo University. Thanks, Michaela.
Hi, hello. This is Michaela joining from Carlo University. Let's cover individual versus community approach to active shooter preparedness. There's not much of a difference. Preparedness is preparedness. It's recommended that you prioritize your safety by getting away, barricading doors, hiding, and calling the police at the safest opportunity. Your last-ditch effort should always be to fight back, but that's only if completely necessary. Establishments such as hospitals, stores, and other public places usually have protocols already set in place and have staff educated on what to do in the event of a shooter. These educations are reviewed minimally every year. Not all homes are prepared for active shooters or have a plan in place for what to do. Many U.S. citizens have taken it upon themselves to purchase their own firearms. Around 49 million households in the U.S. have firearms. About 4 in 10 U.S. adults say they live in a household with a gun, with 52% of those households having at least one firearm present in the home. Nearly half the world's civilian-owned firearms are actually owned by American civilians. Short-term, long-term consequences. There's no consequences from being educated on what to do when put in this situation, but consequences, if you aren't prepared, could result in serious injury or death. Who's at risk? Who's the vulnerable population? In 2024, the FBI designated 24 active shooter incidences in the US, a 50% decrease from 2023. There were 106 casualties, that's 23 killed and 83 wounded, a 57% decrease from 2023. Anyone can be a victim of an active shooting. One person is not necessarily more at risk than someone else. Risks of someone becoming an active shooter is if they exhibit hostile behaviors based on claims of injustice or perceived wrongdoings, drug and alcohol abuse, increasingly erratic, unsafe, aggressive behaviors, claiming of marginalized or distancing from friends and colleagues, changes in performance at work, sudden and dramatic changes in home life or in personality, financial difficulties, pending civil or criminal litigation, and observable grievances, and making statements of retribution. Vulnerable populations are those who experience homelessness, are veterans, and employees in organizations. They are more likely to be active shooters. As I already mentioned, anyone can be a victim. This is because they often experience feelings of wrongdoing and being the victim of injustice and are often marginalized. Anyone at all can be a victim. There's usually no pattern, and there's no particular selection that is made by these shooters. No one is more likely to be a victim, so someone that is economically unstable, lacks education or access to education, has poor living environments, and lack of social support is more likely to become an active shooter because of these social determinants of health. Cybersecurity and infrastructure security agency courses are offered. Workshops and materials are better prepared for you to deal with an active shooter. They mention behaviors and represent pre-accident indicators and characteristics of active shooters, potential attack methods, how to develop emergency action plans, and the actions that must be taken in an incident. CISA recommends running to the nearest exits, taking cover and concealment while moving away from the threat. If you cannot evacuate, then hiding is your next best option, preferably in a locked, secure area. Staying out of the shooter's sight can protect you as well as barricading any doorways. Last resort is to fight. You would want to do this until the threat is neutralized. Call 911 and remain calm. Do this when you are away from the threat and at your safest point. To share a personal story, up until I graduated high school, we've had multiple active shooter threats, with one resulting in an actual shooting that happened when I was in middle school, and a few knife and other weapon incidents that happened along the way. I was so grateful as a student to know the protocol for what to do if an active shooter came, and was so happy my classmates were safe as well. We practiced this protocol at least twice a year, and were very diligent to ensure that we knew what to do in case a shooter came. Many people might say that this isn't a good idea and worry that they may traumatize their children, but I couldn't encourage you more based off of these statistics why it is better to be prepared. To Megan for the rest of your program.
Thank you, Michaela. I have some available community resources and programs to help reduce the risk and improve the preparedness that Michaela was talking about for active shooter events. First off, there are multiple law enforcement agencies. ALICE is one of the top training sites. This stands for Alert, Lockdown, Inform, Counter, Evacuate. The purpose of this is to teach civilians proactive responses and active shooter events. This increases the preparedness in schools, workplaces, and pretty much any public space that this could be applied to. So the DHS campaign is another law enforcement agency that they have a run, hide, fight policy. And this is widely used, especially in public institutions, and that is available online on their website for specific training videos. Specifically regarding school and workplace safety programs, these school rescue officers, or SORs, they are law enforcement officers placed in schools to prevent violence and build relationships. This effectiveness varies. Some communities raise concerns about over-policing. This is one program that is still in progress, working on their purpose. Community mental health resources is a big thing to talk about due to, as Chelsea mentioned before, having the mental health impact on trauma or being prepared for a trauma. The crisis intervention services, they offer mental health support, crisis counseling, and refer to other programs if they feel that you need a different route of help. Community violence intervention programs, these are found in most communities. They address root causes of violence through mentorship, education, and outreach programs. These have been proven to reduce community level violence when funded and implemented properly. Most places have emergency response and notification systems such as Rave, Everbridge, AlertSense. These allow rapid communication of threats to police via phone, text, or email to enhance timely evacuation and sheltering in place emergencies. The community education and preparedness campaigns, these are known as the community drills and public awareness. These are simulated training scenarios that you can go participate in. Schools normally do them twice an academic year to improve response coordination among civilians and students, along with the first responders that would be responding to the incident. Now, what is working for us right now? So campaigns like Run, Hide, and Fight that I mentioned before, or the See Something, Say Something campaign, this has increased public understanding of how to respond in active shooter events in schools, workplaces, and even now, sadly, healthcare settings. Increased law enforcement readiness. The police departments have now received specialized training in active shooter responses, integration while working with schools and law enforcement. They have rapid response teams that are specifically made for these drills. Some gaps that exist currently are lack of standardized training. So training consists, they vary widely across schools, businesses, and jurisdictions. So they might not all have the same training if you move to a different area. Mental health system strain. We all know that there is a lot of mental health going on right now, and services are crucial for prevention, and people may suffer from the shortage of providers and long wait times to be able to talk to a mental health provider. Another gap would be inconsistent follow-up after drills. Drills are often not paired with debriefing, emotional support, or improvements to response plans. So some drills can actually traumatize participants if not carefully designed. Key components would be to develop modular training programs tailored for schools, workplaces, faith-based institutions such as churches, and public spaces. These can be delivered through free online courses, mobile learning apps, and even in-person community workshops. To facilitate mental health and social support access, we normally partner with local health systems and universities to offer crisis intervention training and to expand access to telehealth and mental health services. So resources needed to help plan these programs are you would need personnel and expertise such as a program coordinator, trainers, mental health professionals, IT support, and volunteers and community ambassadors. Our key stakeholders would be obviously local government and emergency management, law enforcement, policemen, public health and mental health agencies, schools and educational institutions, healthcare facilities, community organization and faith groups, parents, students, residents of a community, and along with private sectors and employers of the same community. So the cultural competence theory, this theory emphasizes the need for programs to reflect the benefits, values, and communication styles of the communities they serve. This meaning we need to develop bilingual and bicultural training materials, which involve faith-based leaders, elders, or authorities in planning these drills. Critical race theory. This is CRT focuses on how systemic inequality and racism shape experiences and access to resources. We need to recognize and address distrust in law enforcement among Black, Indigenous, and immigrant communities when designing threat reporting systems. So in summary, we just wanted to let you have a key message of today's top news story to heighten the fact that despite such a sensitive topic, it needs to be discussed and considered. Families need to create an emergency response plan to have in place for an unimaginable disaster. We hope today's broadcast will aid you and your family in creating one of these response plans, and you can find our take-home points in our newsletter that will be posted on our news website. Thank you guys. Have a great day.